to Talk Me Healthy. My name is Sherry Keating, founder, Diabetes Care Consulting. The goal of Talk Me Healthy is to provide you education on how to live your best life every day starting today. Each show will bring a different health-related topic and exciting guests to share their expertise, passion, and personal stories. My hope is you will hear something that motivates you to make a small step towards living a healthier, happier life. Hello, welcome to Talk Me Healthy. This is Sherry Keating, your host. Today's show, we're going to talk about a very serious epidemic called the prediabetes epidemic. And today, as my guest, I have Max Alderman, who is from the Department of Public Health, and he is the Diabetes Program Coordinator. So Max, thank you so much for coming on the show. I want to welcome you, and I know that you traveled from Boston, so I appreciate you taking the time to come out. And how are you?
I'm very well. Thanks for having me.
Oh, you're very welcome. Actually, Max and I have known each other for maybe a couple of years now.
Yeah,
yes.
So.
And Max is the reason I actually started my company. He may not know this, but when I heard about the diabetes prevention program, I actually reached out, was given his name, reached out to him, and he signed me up for the life coach class, and that actually made me realize this is a huge problem that needs to be, people need to be educated on. And so I became a life coach and started a company to do just that. So my thanks to you. I wouldn't be where I am today without that phone call. So thank you. Yeah, so tell me, Max, how did you get involved in the as the diabetes program coordinator for the Department of Public Health?
Yeah, well, I got my start working at a community health center in Boston in the pediatric department, where we worked with a lot of families who were suffering from obesity and the results of that, so hypertension, diabetes, and it was that experience working with those patients that kind of led me into public health, wanting to look at more of a kind of a policy systems level for addressing chronic diseases. And so I got a master's in public health from Boston University in health policy management and the concentration in social behavioral sciences. And that work there led me to doing some work with the CDC that focused on kind of hypertension, obesity on the city level, and then got involved with diabetes program at the Department of Public Health, doing similar work on CDC level grants, but this time at the state level. So now working on diabetes prevention and control across the state.
So that sounds like you've really had a lot of experience in diabetes. So you're kind of at the forefront of this epidemic and all the things that are centered around this epidemic to get the word, to increase awareness. So the awareness, I'm noticing that is a huge, huge problem. And I know that's something that the Mass Department of Public Health and the CDC is addressing. So can you tell us a little bit more about the efforts that are being done?
Yeah, absolutely. So we know about 30 million Americans have type 2 diabetes, and only about a quarter of those folks are actually aware that they have diabetes. So awareness for many chronic diseases is an issue. But then looming below that, we have about 84 million Americans that have prediabetes, and more shockingly, only about 10% of those folks are actually aware that they have prediabetes. And so prediabetes, for folks who aren't familiar with that term, was previously referred to as impaired glucose tolerance, but has since the ADA has coined this term prediabetes. And essentially what it is it's indication of elevated glucose or sugar in your bloodstream, but that's not quite at the level of diabetes. But we know that folks who have this elevated blood glucose levels are predisposed and increased risk of developing type 2 diabetes, in addition to having increased risk of developing heart disease, stroke, and other complications. And so the awareness factor is really a big deal. So we want people to understand that prediabetes is a thing, and that it can be prevented.
So why do you think there is awareness issue? Do you think it's because it's a new term that's been coined and people know it by the old term, or do you think that there's just a lack of education from all different places, whether it's the provider, whether, it's research on the internet. Like, what do you think is the problem with the awareness?
Yeah, so I think it's a complex issue. I think there's many different factors that go into this lack of awareness. So I think part of it is the term is relatively new, right? So I think it was just coined kind of prediabetes in the 90s and early 2000s. And part of that is, many of the primary care physicians, they weren't taught it in med school necessarily. So there's just been this shift for kind of naming it for what it is. And then on top of that, there wasn't an evidence-based way to prevent it. So there wasn't the belief that naming it really had any benefit or screening for it. But now we know that that's not the case. We know that there is an evidence-based management and prevention protocol for screening people for type 2 diabetes, and that there is some benefit to identifying people who have prediabetes and helping them reverse that condition.
Okay, so diabetes is reversible?
It can be, yes. So there are many different factors that kind of go into someone's risk for type 2 diabetes, such as your age, genetic predisposition, how physically active you are, and other conditions.
Like high blood pressure,
high blood
elevated
pressure.
cholesterol.
Yeah, absolutely.
Yeah.
So there are some things that you can change and some things that
Right.
you can't change. Because we know as you get older, your risk increases as well. So it's important to kind of focus on those things that you can change. And so when it comes to type 2 diabetes, in particular if you're able to catch it early on in the stage of prediabetes, that there are lifestyle changes that you can focus on, such as being physically active, eating healthier, losing weight, that can drastically reduce your risk of developing type 2 diabetes.
So you know what I hear all the time? Lifestyle changes. Lifestyle changes. If you change your lifestyle, it's going to affect not only your risk of diabetes, but so many other of the chronic diseases that people live with.
Absolutely. So I think there's this phenomenon in the medical system that we have a reliance on medicines and the pharmacological approach to kind of dealing with some of our chronic illnesses. But when you kind of look at kind of how these illnesses develop, many of them can be stemmed and managed with kind of making simple lifestyle changes. And though it's something that, sounds easy enough to say, right? So,
Right.
Making these lifestyle changes, but we know that behavior change is difficult and that there are a lot of things that affect those behavior changes. So it's more than just, having the willpower, right, to resist sweets and, the drive to be physically active. There are a lot of things that take place in our environment, in our systems that kind of shepherd us in certain directions and influence our behavior change. So what we're doing at the state level is really taking this holistic approach to looking at the built environment. So how can we make where you live, make it easier to be physically active by looking at the transportation, having parks and walkways that are well lit and safe. So kind of trying to make the healthy choice the easy choice. So that in addition to kind of focusing on these healthy lifestyle changes and behaviors that can be made on the personal level, it's really the spectrum. And so at the department, we try to look at it from that kind of holistic approach.
I love the fact that the new ADA guidelines came out and actually lifestyle changes plus whatever medication they meet, it's always in addition to like lifestyle changes plus something. So really the focus really is around lifestyle changes, and people think that you need to lose a lot of weight, you need to do a lot of exercise, you can't eat this, you can't eat that. And really the research for diabetes prevention is surprisingly not as difficult, I think, as people or think it may be. I was very surprised when I saw the research from the diabetes prevention study that really showed that this was not the case, that it wasn't a drastic change in your weight, in your exercise level, and in your diet. So tell us about that research.
Yeah, so this was a NIH, so the National Institutes of Health, funded trial. So it was throughout the country. It was a massive randomized controlled trial when they looked at 3 study groups. So the control group, a group of folks that received metformin, so it's a common drug used to help folks with diabetes manage their symptoms. And then the third group was this lifestyle change intervention. And the target of the study was for folks who had this prediabetes, so they were at increased risk for type 2 diabetes, and seeing if there were some mechanisms that could be used to help reduce it. And so what the study found was that the folks who were in this lifestyle change intervention were able to reduce their risk of developing type 2 diabetes by over 58%. So this was twice as effective as those folks who were enrolled in the metformin group, so the pharmacological approach, which was only about 30% effective in reducing type 2 diabetes risk. So this was, in terms of randomized controlled studies, overwhelmingly successful. So much so they actually had to stop the trial early to actually, since the lifestyle intervention was so successful, that they had to offer it to the other folks who were in those other control groups. So, this type of evidence base for the lifestyle intervention, was something that, the CDC then got behind. And since the results of those studies came out, both the CDC and state and local government have been trying to scale this diabetes prevention program. And so something that we're doing at the state is trying to increase the accessibility for this program for folks who may be at risk for prediabetes, since we know in Massachusetts about 35% of the adult population is likely having prediabetes, and actually our awareness level is a little lower. Around only 7% of people are actually aware that they have prediabetes. So trying to make this program more available for folks so that they see that they can have this opportunity to reduce their chance of type 2 diabetes. And what this lifestyle intervention found, as you were noting, is that you didn't have to make such big changes.
Right.
So what they found was that some of the key component was weight loss, so losing about 5 to 7% of body weight, which for a 200-pound person is about 10 to 14 pounds, to have a clinically significant impact on reducing their chance of developing type 2 diabetes. In addition to that, what they found is that people who were able to work up to around 150 minutes of moderate to vigorous physical activity each week, which equates out to about 30 minutes 5 days a week, were also found to be more successful in warding off type 2 diabetes. So those two components around the weight loss and the physical activity seem to be pretty key in terms of the success of this program. And I think what was surprising, or perhaps not surprising for folks, is how little it may take just to take on those lifestyle changes that can make such a big impact, especially compared to the pharmacological approach.
And two things, the weight loss, I just want to talk a little bit more about that. The 5 to 7%, the 10 or 14 pounds, which is so minimal, really. The key was not only the exercise, but also what they ate. So the healthy eating part of that. And when I ask patients, what do you think causes prediabetes? They always say sugar. And that is not the case in what the study showed.
Right. So in terms of the healthy eating component, I think the program in general focuses on calorie reduction, right? So this balance between the calories you consume versus the calories you burn. So in general, in terms of the weight loss strategy, the focus should be on minimizing your calorie intake and increasing the amount of calories you burn in terms of physical activity. But we know that a calorie isn't a calorie. There's a great variation in terms of where you get those calories, whether it's from starches and sugars, or fats and alcohol. So I think overall, focusing on a kind of balanced and healthy diet, I think one of the mainstays of this program is that it's not a fad diet program. It really focuses on maintaining these healthy behavior changes and lifestyle changes in the long run. And so many of these diets that may be popular in terms of the Atkins diet and intermittent fasting aren't things that are sustainable.
Right.
So getting people to really focus on how they can balance their diets by really just operating in moderation, increasing their fruit and vegetable consumption, striving for that 5 servings a day. Just doing that actually reduces the amount of other calories that you'd be taking in terms of some of those fats and sugars, which we know can be harmful in the body if taken in great amounts over the long term.
So what I always teach patients is my plate, and I just feel like that's such a great, because it really focuses what you're exactly talking about. You take your 9-inch plate, you divide it in half, fruits and vegetables on one side, the other half you divide in half again, so you have your lean protein, your whole grains, and your low-fat dairy. So it meets the dietary guidelines, it helps people with balanced meals, it lowers their saturated and trans fats, and then so they're getting their balance of healthy carbs, because carbs people think are a bad thing, but it's the source of the carbs that makes it not as healthy if you're getting your whole grain carbs versus your white carbs. So, I think that is great advice in the saturated fat and trans fats. The new food labels are also going to help in terms of the added sugar, because they're going to really boldly say that on there. So I think, we're moving to a place where, and trans fats are going to be outlawed. So the good thing is that we're moving to a place that's going to make it easier for people to eat healthier and lose that 5 to 7%. And the exercise. And isn't it true that if you exercise that 30 minutes 5 days a week, but you don't have to do the 30 minutes all at once. You can do 10 minutes, 10 minutes, and 10 minutes as long as you're doing a moderate pace. I tell my patients, not like you're going on a Sunday drive. You actually have to, feel your heart beating a little more. Maybe your breathing is increasing a little bit, so a moderate pace. But 3 times a day for 10 minutes, you're going to get the same benefit, correct?
Yeah, and so that's the other great thing about the programs. I think a lot of folks, when they think about physical activity and sweating, they feel like they have to go to a gym or take these super intense classes, which is really just not the case. So a lot of the tenets of the diabetes prevention program are about integrating physical activity into your daily lifestyles. You don't need a gym membership necessarily to be physically active. So it can be and the focus again being on moderate to vigorous physical activity. Which, what does that mean to folks? Is people use the comparison in that you can talk but not sing. So you're getting your breath up a little bit, but you're not totally overexerting yourself. And some activities can be as simple as walking. So going out on 10-minute walks in the morning, or after a meal at night, or during the middle of the day at lunch, or for just 10 minutes can be great ways of achieving that 30 minutes a day. In addition to all sorts of other activities, such as you can do outside, riding your bicycle, swimming, rowing, playing other sports. There are multiple ways that people can better incorporate physical activity into their daily lives, without that reliance necessarily on cars and those other competing factors such as television and other things that such as many of our jobs are very sedentary. So just making some extra effort to get up, walk around throughout the day can really add up.
Absolutely. So who is at risk for prediabetes?
Well, I'm glad you asked. So there is a really easy way to figure out if you're at risk for prediabetes. The ADA has created this 7-question risk test. So this is something that we have on our state website. In addition to the CDC has also made it really easy you can take this online at www.doihaveprediabetes.org, which is probably one of the easiest ways to find out. But we've also made it available in this convenient format that the ADA has created. And if you want, we can run through the questions together with folks in the audience.
Absolutely.
And so this is a really quick and easy way. It takes less than 2 minutes to figure out if you're at risk for type 2 diabetes. So the first, if you want to do it with me, you can count on your hands. Hold up 1 finger if you're in your 40s, 2 fingers if you're in your 50s, or 3 fingers if you're in your 60s. Hold up another finger if you're male. Another finger if you have had gestational diabetes, so diabetes during pregnancy, or gave birth to a baby weighing more than 9 pounds. Another finger if you have a mother, father, or sister, brother, so direct relative who has also had diabetes. Another finger if you have been diagnosed with hypertension.
Or high blood pressure.
Or high blood pressure.
Mm-hmm. And one thing about that is even if you're under control, you still have to get a point.
Correct.
Because people think, oh, I don't have high blood pressure because I take meds and it's under control, but you still do. So give yourself a point if you do.
Still puts you at increased risk. 1 point if you're not physically active. So if you're getting less than 10 minutes a day or a week, put a finger up. And then in terms of your weight, so if you are overweight, that's 1 finger. If you are obese and fall in that category, that's 2 fingers. And if you fall in the category morbidly obese, then that's 3 fingers. So if you are following with us and you look at your hands right now, if you have more than 5 fingers up, then that means you're at increased risk for type 2 diabetes. And so the recommendation is that you should consult your primary care physician and get tested. There are 3 diagnostic blood tests that you can take. The hemoglobin A1C being the most readily available and easily to take. And so it's really important that you have that conversation with your doctor. And again, being at risk for type 2 diabetes, once you get tested, if you are diagnosed with prediabetes, the good news is that you can prevent it. It is reversible. So I think there is a positive underlying message for this screening test. And being able to find out earlier before you do develop full-blown type 2 diabetes that you can prevent it. Because once you do develop type 2 diabetes, that is not reversible. You can control it and manage it, but it is something that you will have for the rest of your life.
And so so everyone take the prediabetes test. Do I have prediabetes.org, or your doctor may even have those in the office. And for providers, healthcare providers, if you want to screen your patients, you can order these through the Mass Clearinghouse, correct?
Correct.
And you can go on their website and you can get 500 of them and you can keep them in your office, and that will really help with the prediabetes epidemic that we have in our country and help reduce the risk of developing type 2 diabetes. So that's really good. Thank you for bringing that. I appreciate that. So the test that Max was talking about is the hemoglobin A1C, and that's really like a camera snapshot looking back the previous 3 months to see how well your blood sugars have been controlled. So the numbers for that you want to look for is 5.7 to 6.4%. So write those numbers down. If you have the blood test and you're between 5.7 and 6.4, then you do have prediabetes. And the other is the fasting blood sugar, which is another common test where it's just an 8 or 12 hour fast. If you are between 100 and 125, so write those numbers down, then you have prediabetes. And like Max said, it is only 5 to 7% of your body weight. You have to lose through healthy eating and exercise. And not only 58% reduction of your risk, but if you're over 60, it really goes up to 71%.
The effectiveness of the program, yes. So it was found to be even more effective in adults over the age of 60. And we know that, again, as you get older, your risk increases. I think the estimate is about 50% of folks over the age of 65 are estimated to have prediabetes. So, again, because of that lack of awareness and that increased risk, we really encourage folks to take the risk test, talk to their primary care physician, and take action in seeking out a diabetes prevention program. So there are a few places that you can find your nearest diabetes prevention program. One is by visiting the CDC's website. They have a whole registry of all the CDC approved diabetes prevention programs in the whole country. You can also visit our state website, which is www.mass.gov/DPH/DPP. And what you can find is more information about the diabetes prevention program, as well as a complete list of the diabetes prevention programs that are being offered in our state, with contact information, so you can reach out to ones that are in your town or area and find out if they're starting a class near you.
And so don't worry, all those websites and those numbers and everything will be up on the show and you can view the show on the Sterling Lancaster Community TV, or I also post it on my company's website and YouTube channel, which is Diabetes Care with a K Consulting. So we will have all that information. So don't worry about that. So it will be available to you. So how many diabetes prevention programs are there right now in the state? And then is it insurance covered? Because I know that is a big, we're working on improving that process.
Great question. So we have just over 40 DPP providers throughout the state. A majority of those are through the YMCAs, but there are many other independent community-based organizations that also offer the diabetes prevention program. There are even some that are virtually offered, so you can take online over your mobile phone. So there are even more and more options that are being made available to U.S. citizens in this day and age, and in Massachusetts as well. So it's important to check the website and see if there are classes near you. If not, there are these virtual options that people can take.
Oh, that's great. So in terms of the risk, one other thing I wanted to bring up is if you scored 5 or more and you did get tested and you did have prediabetes, I believe the study, did it show that certain people qualify for not only lifestyles but metformin as well? If they were under 60, history of gestational diabetes, and they were a certain weight, they also could qualify for the metformin. So that's another reason to go and get tested to know if you have prediabetes, and then because you may qualify for that as well, which between the lifestyle and the metformin, that helps your risk, lower your risk as well. Is that correct?
Right. So, metformin, again, the drug that is typically used by folks with type 2 diabetes to help control their blood sugar levels, can also be prescribed for folks with prediabetes. But as we saw with the Diabetes Prevention Program research trial, lifestyle, the intervention, the lifestyle changes were more effective than the metformin. But of course, as you get older with age, it might be beneficial to also, in addition to the lifestyle changes, take metformin to help in that control of blood sugar.
All right, that's great. Well, we've covered a lot. That half hour went by really quickly, and so I want to thank you so much for coming on the show, and we want to leave people with really some key messages that they can take away. So what would those be, do you think?
So the key messages I would say are, first, prediabetes. It is a thing. So it's important to take the risk test. It takes less than 2 minutes. You can take it on the doihaveprediabetes.org. If you find out that you are at risk for type 2 diabetes or prediabetes, go see your primary care physician. Get a blood test, diagnostic test to see if you do actually have prediabetes. And if so, seek out a diabetes prevention program to help you make those lifestyle changes to help reduce your risk of developing type 2 diabetes.
Excellent advice, Max. Thank you so much. And I just want to add as well that my company, Diabetes Care Consultant, I also offer one-on-one health coaching for people that have prediabetes or type 2 diabetes, and I offer CEU programs because really what my mission is, as well as aligned with the Department of Public Health and the CDC, is to increase the awareness and to teach people the proven lifestyle changes from the diabetes prevention program. So my contact information will also be on the show. And I want to thank you again, Max. I really appreciate it. This is such valuable, important information that we need to get out to everybody. And hopefully we're going to make a difference in the lives of many people.
I hope so.
I hope so too.
Thanks,
so thank
Sherry.
you for making this trip down. And I want to thank you for tuning in again. And next month we are going to have a show on the tools that you can use to start thinking about who you want to help make decisions when you are unable to make decisions for your health. So please tune in again next month. It's going to be a great informational show. And remember, until then, to live your best life every day starting today. This is Sherry Keating, and have a great day.